Hello friends. So today I am going to talk about ear related issues in infant and children. So children and or infant are more susceptible towards ear related issues. There are several reasons for the same. So most commonly we see ear diseases in infant and children. So according to a research, 5 out of 6 children can have ear infection by the age of 3 years. So through this data we can see that infant and children are more susceptible and there is a more chance to get ear diseases. If we talk about ear diseases, we are going to mainly talk about ear infections. So infant and children may get ear infections. The main reason of ear infection in children or infant is eustachian tube position. So if you see the position of eustachian tube in infant and small babies, it's actually horizontal in position. So because of the horizontal position of eustachian tube, while eating or drinking some fluid like Cerelac or milk, these things can easily enter into the middle ear through eustachian tube. So when they get older, their eustachian tube gets vertical and more vertical, and finally it attains an angle of 45 degree. So that's the reason that adults are not so susceptible of ear disease related issues compared to children. They are less susceptible adults. So if your child get ear infection, you should must consult a ear doctor or an audiologist for the same. What an audiologist will do? Audiologist will do a otoscopy, and after otoscopy, audiologist can also do a test called tympanometry and reflexometry, and then they can give a diagnosis of middle ear infection, and then they can refer to an otolaryngologist for further treatment. Or in the same way, an otolaryngologist can refer the child or infant to an audiologist for the diagnosis. So let's come, what are the sign and symptom of ear infection in small children or infant. So you may see, if you see that your child is putting hand, putting finger in the ear frequently, or your child is crying a lot, or if you see sleeplessness, discomfort, or putting a finger repeatedly in the ear, in that case you should must consult an ear doctor. The and suppose if this ear infection happens on a frequent basis, in that case you should be you should worry, because frequent ear infection can lead to a speech and language delay. So as an audiologist, I want to aware you that if your child shows a symptom of ear infection, technically we say it as we say the term as otitis media. Ear infection, we say it as otitis media. So if your child show these symptoms, like putting finger in the ear canal, discomfort, if the child is crying a lot, sleeplessness, in all those conditions, you should not ignore it, and you should refer, you should consult to, to an audiologist or an otolaryngologist for the same, for their assessment and treatment. So I think through this video now we must be aware about ear related issues in children and infant. So basically we say it as otitis media. So so otitis media also has different stages. Like first it is acute otitis media, and then it can become chronic otitis media. So we should not wait to make it like a chronic one. We should treat it at a very early stage of acute otitis media. Thank you. We will meet in the next video.